most recent MDA meeting in regards to Duchenne muscular dystrophy and the more recent information about treatment options for patients with Duchenne, definitely gene therapy is the leading information and new exciting news about treatment options for patients with Duchenne. Also different RNA therapies and outcomes from the available RNA treatments that we have today. Some new exciting news about new therapies that may be coming down the pipeline. So those are all new exciting news in the field of Duchenne muscular dystrophy.
Yeah, so the primary messages that I took away there were actually a couple. I thought that there was some interesting information regarding exon skipping. I think that there was additional information on atalurin, and I think we were all interested in seeing some of the data coming out for gene therapy. And I think that it's nice to be able to see that there's additional data that supports the efficacy of some of the exon skipping drugs. There's additional information to suggest that there's efficacy of atalurin, and it's nice to be able to see some of the preliminary data that's come out on gene therapy.
One of the information that we got out of the meeting is that the gene therapy RH vector seemed to be safe in patients who were injected with the gene therapy, and that was over a long time follow-up. It was well tolerated. The side effects, I believe, were probably what's expected with gene therapy in that particular trial. And it shows promise that this is a treatment that could benefit a larger subset of patients with Duchenne rather than just the mutation specific gene therapies or RNA therapies that we have available today.
Well, I think the newest piece of information is the approval of Chasmersin, which is the latest exon skipping drug that's designed to skip exon 45. There wasn't really any efficacy data that was presented at this meeting, but I think that there was some safety information that was provided, which was quite helpful, that would help us who are treating Duchenne muscular dystrophy to understand this medication a little bit more. With regard to the other exon skipping medications that we are currently using, there was some additional information on Chasmersin, looking at some of the efficacy information. And the other data that was presented was on atalurin, which is not actually a medication which is commercially available at this point, but that was also very interesting.
We should discuss with the patients and parents early on that there is new treatments coming down the pipeline, and that there will be hope and option for patients that are that is not mutation specific. So I see that that some patients may get discouraged or upset because some of the therapies that are available now may be mutation specific, but with the gene therapy, this provides hope and encouragement that there will be more therapies available for more and a wider subset of patients with Duchenne muscular dystrophy with different types of mutations.